Hello, welcome to Design for Recovery. I am Lowo Adeyemi, and today we are addressing an essential question in modern medicine. How can we create hospital capable of withstanding future pandemic? The COVID-19 pandemic served as a significant alert for the healthcare system, revealing critical shortcomings as hospitals faced overcrowding, staff burnout, and infrastructure limitations. However, this crisis also provided invaluable insight into effective design. In this discussion, we will explore evidence based design solutions that are being applied to transform hospital into resilient, adaptable, and healing environments. Let's dive into this important concept. The concept of modular design in hospital represents significant advancement in healthcare infrastructure. The approach allows for rapid transformation of medical spaces, such as moving walls, expandable ICU, and operating room that can function as emergency ward. A notable example is the Singapore Ng Teng Fong Hospital, which effectively converted wards into ICU pod within 48 hours during the surge of COVID-19 cases. This efficiency was made possible by employing plug and play utilities including ceiling mounted oxygen, power, and data ports, enabling room to adapt on demand. According to 2023 studies in health environment research, modular design can reduce conversion time by as much as 70%. Flexibility in hospital design extends beyond moving walls to include the use of shell spaces, pre-wired, unfinished area design for quick activation when needed. These serve as emergency reserve in healthcare setting. Additionally, the implementation of decentralized utilities such as backup power grids and water system ensures that hospitals remain operational even when central network experience failure. This adaptability highlights the importance of viewing hospitals as dynamic entities rather than static buildings. Infection control has become a critical focus in healthcare design, particularly following COVID-19 pandemic, which underscored the dangers of airborne transmission. A 2021 report from World Health Organization revealed that 40% of hospital outbreaks were attributed to inadequate ventilation. To mitigate this risk, hospitals are now incorporating 100% outdoor air system that supplies fresh air to the patients, successfully eliminating contaminants. Research from Harvard indicates that this system can reduce viral concentration by up to 60%. Moreover, the integration of UVC lighting within ventilation system has proven effective in reducing healthcare associated infection HAIs as demonstrated by the Cleverly Clinic, results showing that 20% decrease in such infections. The use of antimicrobial materials such as door handles made from copper alloys has also shown significant promise. A study from UC Davis reported 58% reduction in MRSA infection. Furthermore, optimal space layout such as wide corridors measuring 12 feet or more, aid in preventing bottleneck during patient surge, a strategy effectively utilized by Taiwan during the SARS outbreak. The intersection of technology and human factor in healthcare setting is increasingly important. Hospitals are implementing real-time occupancy sensors like those used by Johns Hopkins to enhance operational efficiency and reduce emergency room wait time by 25%. These sensors notifies cleaning staff when a room becomes vacant, thereby minimizing the turnover time for patient use. Telehealth initiatives are playing a vital role as well, with organizations like Casa Permanente achieving a 40% reduction in patient no-show through the use of some proof virtual care ports, allowing patients to consult with doctor from designated area like parking lots, thereby lowering potential exposure. The well-being of healthcare staff is another critical consideration, especially in light of rising burnout rates. Decentralized nursing station has been shown to save nurses an average of 1.5 hours per shift by optimizing workflow. Additionally, incorporating biophilic design elements such as green walls and healing gardens has been linked to improve patient outcomes, with a 2021 study in the BMJ indicating that patients in sunlit room require 22% less pain medications. Access to nature also has shown to reduce cortisol levels in healthcare workers by 17%. Ultimately, the integration of technology in healthcare is aimed at enhancing human experience and efficiency, allowing medical professionals to focus more on patient care rather than administrative burden. Research shows that green hospitals are better equipped to handle crises like pandemic. For instance, in the aftermath of Hurricane Maria, hospitals in Puerto Rico that had solar panels were able to maintain operations while others lost power. Solar battery storage not only supports environmental goals but also provide a critical backup during emergencies. Water conservation is another essential aspect in sustainability. Rainwater harvesting systems, such as those implemented at Seattle Children's Hospital, help reduce dependence on vulnerable municipal water supplies. Moreover, smart glass windows that automatically adjust their tint can decrease HVAC cost by up to 30%. The benefits of this sustainable practice are significant. A 2023 report in The Lancet found that hospitals embracing sustainability saw patient recovery time improve by 15%. Therefore, sustainability is not merely a trend, it is a fundamental requirement for survival in healthcare. To illustrate this concept, we can examine the redesign of Parkland Hospital in Dallas following the COVID-19 pandemic, which was built around three key principles. First, flexible spaces capable of accommodating over 200 additional beds during surge. They integrated vertical garden that not only improve air quality but also enhance overall environment for both patients and staff. And thirdly, they implemented an AI-driven HVAC system that adjusts airflow based on real-time occupancy data. The essential takeaway from this discussion is that hospital design to withstand pandemics are not defined by their structural material, but by their capacity for adaptability, data integration, and empathy. Every design solution should address three crucial questions. Does this promote healing? Does this offer protection? Does this allow for flexibility? The vision for future healthcare is not a distant aspiration. It is actively being realized today through features like copper clad doors handle, modular ICUs, and corridor filled with natural light. We must prepare adequately for what lies ahead. Thank you for listening to Design for Recovery today. For those interested in deeper research, I encourage you to check the show notes for links to WHO guidelines. And until next time, remain inquisitive, critical, and continue to envision a better solution. Don't forget to like, rate, send in your comments, and subscribe to our weekly discourse. My name is Lowo Adeyemi. I am signing off with a reminder: the most effective hospital not only treats illness, but also work to prevent them. See you next time. Goodbye.